Today we will be discussing Chapter 3, which is Patient Census Data. Inpatient census basically is the number of patients present in a healthcare facility at one particular point in time. It's important to remember that only inpatients are included in the inpatient census, so there may be other patients in the hospital at that given time in the ER, observation, x-ray, different areas of the facility, but it's important to remember it's only inpatients. Each individual on what we call a PCU, or a patient care unit, is designated to count the patients on the unit each day at a specific time. The time must be consistent across all units in the hospital. Generally, around midnight or at midnight is a good time to take census. Most patients are in their beds instead of at x-ray therapy, those kinds of places that they are during the daytime hours. The census can be done manually or computerized. More often than not, it is computerized with the development and more frequent use of electronic medical records. But in a manual system, the census taker would simply fill out a form and send that to a central area. The form is, a sample of that is in your book, Table 3.1 in Chapter 3. You can see a sample of what a paper form would look like. You can see it includes the names of the patients admitted, discharged, and those transferred to another unit. The computerized system, a lot of that initial information is generated already in the computer system when they are admitted, and then the person would have to verify where those patients are, if they're still there, if they've been transferred, that kind of thing. So in addition to reporting the inpatient census, each unit also has to report the number of patients admitted, discharged, and transferred in and out on that day. So the census is more who is there at that specific time, where the complete master census basically lists where did everybody go that was in and out that day. It's commonly referred to as the ADT system, admit, discharge, transfer, within hospitals. So the complete master census will show the names of patients present at a particular point in time and their location. Most facilities, again, have this process computerized that links to the master patient index, the billing system, and the EHR. Throughout this entire book, it's important to remember that the term transfer, when we're talking about an inpatient hospital setting, is an intra-hospital transfer. And intra-hospital transfers, those are the patients who are moved from one unit to another within the facility. Transfers in and out of a unit may not be equal because it's possible to transfer more patients in than transfer out and vice versa. The daily inpatient census. This includes the number of inpatients that are present at census taking time, generally midnight, each day, and it includes any patients who were both admitted after last census taking time and discharged before the next census taking time. So a patient admitted to the hospital at 8 a.m. on June 1st and discharged at 10 p.m. that same day obviously is not going to be present at the midnight census taking time, so they would not appear on the census report. But for daily inpatient census, we also add those admit and transfer, admit and discharge on the same day. So that would include that extra patient. An inpatient service day is a unit of measure that is the services rendered by one inpatient in one 24-hour period. The 24-hour period is the time between census taking hours on 2 consecutive days. So one inpatient service day is counted for each inpatient admission when the patient is admitted and discharged on the same day. There are some important issues concerning inpatient service days that we have to note. 1 unit of one service day is not usually divided or reported as a fraction of a day. We have 1 day or there isn't any. The day of admit is counted as a service day, but the day of discharge is not counted. Adults and children are going to be calculated separately. So if you're asked to complete the inpatient service day in a problem, you would not include children unless it specifically asks for adults and children, because generally those are calculated separately. The days a patient is not in that bed due to a leave of absence, those are excluded from our inpatient service day counts because they are not there at census taking time. The leave of absence day is a day occurring after the admission, before discharge, when the patient's not present at census taking time because they're on a leave of absence from the facility. This is more common in patients that have long-term patients, nursing homes, mental health institutions, drug and alcohol rehab programs. So those patients that are there for longer than someone that's in for an acute or chronic illness in an inpatient setting. Inpatient service days does go by a different set of terms, but all of these things on this slide mean inpatient service day. A patient day, an inpatient day, bed occupancy, census day. All of those, they have day, they mean inpatient service days. The term total inpatient service days is basically a sum of all inpatient service days within that period that we're looking at. So we would simply add our service days together. The calculation of inpatient service days is a measurement of services received by all inpatients in one 24-hour period. The usual reporting time frame begins at 12:01 a.m. and ends at 12 a.m. midnight. If you remember from an earlier slide, a transfer in our textbook refers to an intra-facility transfer. Transfers in and out of any specific unit of the hospital don't necessarily have to be equal, but they must be equal for the overall hospital calculation because they're all in the same facility. Every patient transferred into a unit on any given day has to have been transferred out of another unit to be considered a transfer. Patients that are admitted and discharged on the same day may be referred to as in and out patients or admit-discharge patients, A and D. Remember, when we're computing inpatient service days, we need to add the number of patients, A and D, or admit and discharge on the same day to our 11:59 p.m. census to get the correct result. Recapitulation of census data is the process of verifying the data obtained by the process described previously, and that is over the month or year compilation of census data, or basically it's a summary of the data. The total number of patients admitted and born during the month or year is added to the patient's remaining census with which the month or the year began. So from this sum, the number of discharges, including deaths, during the period is subtracted. The resulting data are the number of patients remaining at the end of the period. This should equal, if it's done correctly, the actual head count at midnight on the last night of that period, whether it be that month or that year. The average daily inpatient census, this is our average number of inpatients present each day at a specific point in time. The total inpatient service days for any period, usually we're going to be calculating a month or a year, and then that will be divided by the total number of days in a period. The formula is listed there on the slide for you. And remember, when we're calculating the average census for a month, we need to know how many days are in a month. There's a little nursery rhyme in your textbook. You may have a different way of remembering, but we do need to know how many days are in each month, and if we're calculating a year, whether that was a leap year or a non-leap year. The calculation for computing the average daily newborn census is the same as calculating the average daily inpatient census for adults and children. We have our total service days divided by the total number of days in that period. It is helpful to know what the average use of a specific unit in the hospital is over, say, a year. So that formula is listed here, the total service days divided by the total number of days. And that's the same as the other average daily census that we've been talking about the last few slides. As I stated a couple slides ago, it's important to know for any healthcare statistic computations if it's a leap year or a non-leap year. A leap year, we know, is when there's an extra day added to the calendar in February. So that will give us 29 days in February. So just an important thing to remember if our formula calls for adding the number of